Hello guys, so welcome to my examination series. You will gain a lot. Make sure you focus and watch the video till the end. We teach you in class, in the classrooms. We teach you during ward rounds, in clinics, in theater sessions, and all that. Why do we do that? To make you good doctors. But has it ever occurred to you, you would never even become a doctor if you don't pass your exams? All right, so we've got to give you the opportunity of being that good doctor. We've got to teach you how to pass the exams. So aside reading and going through the process of becoming a good doctor, you must be able to pass the exams, because you can actually read all these things, go through all these motions, but you get stuck when the exam comes. The examinations in medical school are multifaceted, and many people prefer some aspects, some don't, some dislike other aspects. So we're going to be taking them one after the other. We're going to be starting with the essays. Well, I personally believe that most medical students don't like essays. They will prefer to do MCQs because they feel if you have multiple choice questions, I should be able to select the right or the wrong answer, especially when you have 4 options and you're supposed to select one. If you have some good knowledge about that topic, you'll probably be able to answer the right question. But with essays, it's not so, in the sense that the essay just depends on whether you have knowledge about that particular aspect or not. So if you read all night long a number of chapters and we select the question from a single chapter you've not read, you probably fail the exam. But in the MCQ, you have many other options of passing the exam. Right? So this is why some people don't like the essays. But if you know the tricks to writing essays, you will always pass your essays. Now let's get it right. In medical school, we don't want you guys to fail exams. Get that right. We don't want you to fail. So even when we select questions for you to answer in your essays, we would select questions that are fair. So we want the questions to test your knowledge all around, but we want questions that are fair. So what are the things that you're supposed to take note of? I'll give you a typical example of a question in surgery. So you have a question like, a 35-year-old man presents to the accident and emergency with a right groin swelling of 3 years, which became irreducible in the past 6 hours. How would you manage this patient? This is a management question, and it's a very common kind of question you get in your exams. When you see a management question, you must know what you are being asked for. You are supposed to outline how you're going to take care of that patient from the history taken to the treatment and even complications. So you don't just jump to the treatment and say, this is the diagnosis and this is the way I'm going to treat. No, you will be wrong. So you find out that if you jump, you would have missed a lot of marks from the history taken, the examination, and so on. And the way we do it is we divide the marks. So if this is going to be over 25, it means that the history taken will carry maybe 5 marks, your examination will carry another maybe 5 marks, investigations 5 marks, treatments may now carry 10 marks. Or even if treatment still carries 5 marks, there are other things that we add to it, like complications and so on. So even if you don't know how to manage, in terms of you don't know the definitive management of a patient who has that kind of hernia, probably because you don't know the diagnosis, you can still pass that question. How do you go about it? History taking is the first. So you have to start by telling us that you are going to take a history from this patient, and then we've already given you the presenting complaint. You must click around that presenting complaint of right groin swelling. You would ask about pain. You would ask about features of intestinal obstruction. All right? Because you already know that this patient has a hernia. That introduction lets you know the patient has a hernia. So everything you are going to be asking must be centered around it, and you must exhaust all the questions. You will go through the gastrointestinal system completely. You will find out about things that will predispose those patients to having hernias, including the jobs. You will find out about constipation. You'll find out about cough. And then there will be other things like family histories. You talk about medical history, because that all together will give you a full history. So medical history, and you typically write it in prose fashion, maybe like, and I would ask about history of similar swellings in family members. I would ask if he is diabetic, hypertensive, if he has had previous surgeries before. That's the way you write. You say, I will. Not, you don't say you will. Or you can say it in third person. You can say a history of this and that will be elicited. So you will do the drug history, allergies history, and once the history is completed, I can tell you for sure, even if you have no idea of managing hernias, you will get your full 5 marks. Because when we read your essays, we don't read your essays word for word. We skim through line by line, looking for the essential points. Once you've written out the essential points, you will pass that history. And with these few things I've said, you will probably get all your 5 marks, so you might get 4 marks out of 5. You will not fail it. And then you will go to your examination. What do you do in your examination? You start from a general examination. You say, I would examine this patient from head to toe. I will check the conjunctiva for pallor. I will check, that's the way I'm going to be saying it. I will check the sclera. I will check the buccal mucosa. Now we want to know that even though we've told you the problem is in the groin, we are still going to examine that patient fully. We don't like students who will just go straight to the abdominal examination or straight to the groin examination. No. So if you go straight to the abdominal examination, that means you are going to be scored out over 2. If the mark for the abdominal examination is 2 marks out of the 5, you will be scored over 2. So you must go through the motions from the general examination, the chest examination, because chest examination is actually important. You're going to do an abdominal examination, you must include the rectal examination that are going to check this patient's prostate, for example. So you will complete your examination and then come up with a clinical diagnosis. This is very important. Most times there is a mark for the clinical diagnosis. You must have a diagnosis before you even investigate the patient. So in this case, this patient has an incarcerated right inguinoscrotal hernia. And that's because on your examination, you didn't find any features of strangulation. And you remember, he presented within 6 hours. And when you examined, you didn't find any features of strangulation, right? But you know that hernia is irreducible. Then you will go ahead and investigate the patient. Also in investigating, you must go from the most basic to the most complex. So you don't see this kind of patient now and just tell me you are going to do an abdominal CT scan. Abdominal CT scan for a patient with a hernia in Nigeria, even whatever country you are, that's not the way to manage patients. The most important things to do with these patients will have to do with your blood work. You want to do a urinalysis, you want to do a full blood count, and you want to check the renal function of this patient. You want to prepare this patient for surgery because you know that imaging on its own is not really the solution to this problem, right? So it's important to note that even when you list all the investigations, you must list them in the order of priority. And it's not enough to just say you do a urinalysis. What are you looking for in the urinalysis? What are you looking for in the full blood count? What are the parameters you are going to be particular about in the electrolytes? So all those will give you full marks. Once you go through those motions, you get all your full marks. And then you will now go to the treatment of the patient. And that would include giving IV fluids, giving analgesics. Because most of the time, these incarcerated hernias, by giving them just some analgesics and IV fluids, they will reduce spontaneously. You can gently try to reduce, but of course you will not force the hernia back, because you don't want to force the strangulated hernia back into the abdomen. So you can see we've now gone to treatment, and the few things you are going to say as a medical student when treating this patient will let us know if you've been coming to school. If you say, I'll just move the patient to theater, then we know you've not been coming to school, because there are things that must come before moving the patient to theater. You must have given the things I talked about, the analgesics and IV fluids. You must have passed the catheter. Those are basic things that would help you. And then we know that you are a medical student, you are a young doctor. We assume you are a young doctor. You won't be able to do this procedure yourself. It is at this point that you are going to say, you are going to ask for a review from your superior, and you are going to then assist in making sure the patient gets to theater in good time, so that the bowel that I think is not strangulated right now will not become strangulated. So this is going to be an emergency surgery. You will then go ahead to describe the fact, you are going to describe that the repair of the hernia will be done. So in this situation, you want to examine the sac for its contents to make sure they are not gangrenous. Once that is done, the contents are replaced into the peritoneal cavity, herniotomy is done, and then hernography is done, which is the repair of the posterior wall. Those are the things we want to hear from a medical student. So if you have a essay question and you're supposed to complete in 30 minutes, that's enough time for you to complete it. It's enough time for you to write a post-op order saying that you are going to post-operatively, you are going to monitor the vital signs, you are going to monitor the urine input and output, you are going to monitor the NG tube for its drainage, you are going to give an analgesic, antibiotics if necessary, you are going to ambulate this patient on time, you are going to give DVT prophylaxis, and you will commence oral intake once you are sure that bowel function has returned. Then you will talk about complications, possible complications of hernography. So you see, you don't need too much. You don't need so much. Someone who does not even know the contents of the spermatics cord will pass this exam, will pass this question. Someone who does not know the details of the procedure, we don't need you to even know the details of the hernography procedure as a medical student. Of course, if you know the details of the anatomy of the inguinal canal, it will help you in knowing the details of the procedure. Note this. Did you hear me mention anything about ABCD of resuscitation? No. That is because it is not necessary in this instance. We won't give you this kind of scenario and then you will tell me that you are going to approach this patient by going through the ABCD of resuscitation, and you want to check the airway of a patient who walked into the emergency by himself and told you that he has pain in the groin, and then you will be check. You say you want to, can you hear me? You'll be checking his breathing, you'll be checking his airway. No, it already lets me know that you have not been coming to school. You are someone who has just gone to read handouts and then you just want to pour out everything you've read. All right. So if it's a setting where we are giving you a scenario of a patient who was involved in a road traffic accident, no matter how mild it is. We say this patient fell from heights and was brought to the emergency department without any obvious injuries, and we say outline the management of this patient. You will go through the ABCD even though we've not told you the patient has any injuries, because you will then be looking out for hidden injuries. So essays are very easy, because just with a little bit of knowledge and a little bit of coming to school, you will be able to answer the essay questions. So this is the first in the series as regards the essays. I want you to leave your comments and questions so that I can, in subsequent videos, take care of them. If I need to make more videos on essays, I would make those videos. If you have questions about some parts, maybe you've seen a particular question and you think, oh, how do we approach this question? Just type the question in the comments and then I would help you know how to manage those kind of questions. Of course, I'm going to talk about MCQs and other areas of the exam too subsequently. So I wish you all the best. Bye.